Don't have to tell you this, but I'm sure you already know that going through cancer is tough enough. But for many breast cancer survivors, that's just the beginning. Many lose self-esteem after they lose a breast. That's where Smile Artists Africa steps in. They're raising funds for breast reconstruction and to raise awareness and encourage screening. Let's get more now from the founder, Dr. Monaisa. A very good morning to you, Doc, and thank you so much for joining us. So let's just firstly talk about Smile Artists Africa, what the initiative is all about, what it is you guys are trying to do.
Hi, Monaisa. Thanks for having us on your show today. Smile Artists Africa is a collaboration between plastic surgeons and visual as well as textual artists in South Africa. The initiative was initiated by myself and my friend Bazal Langa as an artist. And what we thought we could do was just find a way to spread hope, love, and joy in our country by contributing positively. So what we then did in our first year, 2020, we hosted an art auction, and we used the money raised to fund breast cancer reconstruction for people who do not need it. This is now our third year going, and it's getting bigger and better every year. I think for us, one of the best parts has been the public interest. I think, you know, while I'm a plastic surgeon who does breast reconstruction, you can't really have reconstruction without first talking about cancer awareness, prevention, you know, encouraging young women, especially in South Africa, to go screening early, to have regular checks, and to take any questions to the relevant doctors. So this, for us, this year has been great. We've got a lot of interest. We've got a lot of people that have been wanting to be a part of the show. And so this is what's happening. Next week, Saturday, on the 8th and the 9th of October, we're hosting an art exhibition and auction at the Cradle Boutique Hotel, which is out in Malderstrip, in the Cradle of Mankind.
Doc, let's now talk about breast cancer. There are certain, illnesses and diseases that are seen as illnesses and diseases for a certain LSM. You know, cancers are usually seen as illnesses for, the upper LSM, your 7 to 10. But one would say that's because there is a lack of education, especially for people who are in the lower LSM, to kind of identify, know and understand, cancers, especially cancers like breast cancer. I mean, the kind of education that is out there in the public, is it enough? Do people know? Do those people that maybe do not have access to your internet and such, people in the rural areas, do you feel that there is enough information that is being shared with them about breast cancer, how they can identify it?
I think breast cancer, the two biggest problems. One, it's actually increasing worldwide. It's increasing in young Black women, especially fast, and it's a new kind of much more aggressive cancer. So really, for what we are facing, we need to do a lot more in terms of awareness, in terms of prevention, in terms of educating girls from a younger age, from like the late teens, early 20s, to do regular breast self-examination, and to take any suspicious lumps, bumps, any skin changes, any nipple discharge, and take it to either their local clinic or their local GP. Cancer does not care about your LSM. It seems to us that, we don't know the reason for the increase in worldwide cancer, but especially in Black women and young Black women. And we need to do a lot more genetic testing to identify relevant genes that could be contributing to this. But in terms of awareness, we can definitely do a lot more, and we appreciate the media getting involved in helping us spread this message that we do need to be more vigilant, we need to be more aware, we need to reach out, we need to increase cancer awareness as a whole in South Africa. September was Prostate Cancer Month. This is probably the commonest cancer amongst men. Amongst women, Morena, women have a 1 in 12% chance of developing breast cancer. As of last year's statistics from the WHO, breast cancer survivors form the largest group of post-cancer people in the world at 6.8 million. So there's 6.8 million women walking around who've had breast cancer in the last 5 years. Wow. And of those, you can only imagine the stats of how many people get to actually access reconstructive services and in a way then complete their journey, because having breast cancer and catching it early is not a death sentence, but it is a big operation to have. It's a very scary procedure to go through, and it does leave you with permanent scarring. which can affect, your self-esteem, your ideas of your femininity, your relationships with your romantic partner can all be affected by this. So for us to be able to offer breast cancer reconstruction to people who might not otherwise have access to it, it really is a privilege for us. And this is what we're trying to say is that, as proud South Africans, we're happy to be part of an initiative that's aimed at spreading love, hope, and joy.
Now, Doc, obviously we can't always put the responsibility at the foot of the victim, the patient. We also need to ask ourselves, do healthcare practitioners, healthcare professionals, especially in the public space, do they know enough about things like breast cancer to be able to deal with it? So, Faith goes into a public facility and she's got all the information that she needs to have as somebody, who is probably dealing with this. But then she's now met with a healthcare professional that doesn't understand what any of this is and how to properly deal with it. Is the education, being extended to healthcare professionals as well?
Well, in terms of the level of knowledge of our healthcare facilities and the services available, South Africa uses a tertiary healthcare model. So you would take your local problem to the clinic. If you have a lump in your breast, you go to a local clinic, and from there be referred to the regional or local hospital, depending on your problem. I work at Chris Hani Baragwanath Academic Hospital in the Department of Plastic Surgery. We work closely with the breast cancer unit at Barra. They see about 200 patients every Wednesday. And they biopsy every single patient that needs it. And so I believe that, for the limited services that we do have in South Africa, we do have staff that are very passionate about it, that are passionate about helping people who come to us for help. I do think that, because it is a tertiary health model, you kind of have to do a lot of education or teaching at the grassroots level, at the rural level. Because that's how the system works, to identify and bring people into the central part of the system. So in terms of education at that level, we can always do more. Populations age, people grow, people move. So it has to be a constant messaging. We can't say, yeah, we did it 10 years ago, because the demographics have evolved. People have moved on. And like I said, the incidence of cancer is increasing rapidly around the world, especially of a type of cancer called triple negative cancer. This is a cancer that doesn't respond to traditional hormonal treatment and is increasing, especially in young Black women. So the message of awareness and prevention is very important. At our event next week, Wednesday, the main function of the event is the art auction, but we also will have, we've partnered with Pink Drive on this. We will have them there doing education, offering people free screening, giving people access to information about where they can go. So, and of course, we're going to share all of this live on social media channels, as well as possibly on a TV channel in the future. This is the point of the day. While we are fundraising and we have a lot of work to do in the next year, the day itself is really big for us in terms of spreading awareness and igniting hope.
Doc, someone is sitting watching this interview, and the question that they're thinking about, because they understand that healthcare is not cheap, even when it's at the public sector. A lot of money needs to. You guys are raising money, in fact, because it's not cheap, and cancer treatment is one of those that are even far less cheaper. It's very, very expensive. Someone is thinking that I need to actually go into breast reconstruction. Maybe that's somebody that has been dealing with breast cancer and have probably beaten breast cancer. But that self-esteem that you speak of, how much are we talking? Just for the full process, in fact, how much are we the kinds of figures we're looking at?
Okay, so you need to understand that there's different types of surgeries. Some surgery may involve first placing a tissue expander and then switching to an implant. Some might involve using your own local tissues to do the reconstruction. And often you need to do more than one stage of surgery. You would, build a breast, and you need to match it to the other breast and make sure everything, looks good and the person is happy with the result, because really that's your goal. It's actually your client's happiness. So per surgery, you are looking at starting from about 110,000, 120,000 to to about 250, 300,000 Rand for the more expensive procedures. The free flap, the microsurgery can be a lot more expensive. So we're looking at about, if I average it, maybe a 250,000 Rand per operation. And if you consider, the fact that it is staged, it needs to, you have to do multiple procedures. I think it's about, maybe $250,000 per client.
Oh, that is some heavy numbers considering, the economic climate South Africa finds itself in. But before I let you go, Doc, I know we're talking breast cancer here and, just essentially dealing with breast cancer, considering that it is Breast Cancer Awareness Month. But I want to broaden this particular question to include things like breast reduction. There are women who are struggling, and are wanting breast reduction because a lot of them, at least this is the kinds of conversations I've heard, some of them struggle with their back. So essentially it's an extension of medical problems that are born from, having larger breasts. It's considered by a lot of, if not all, medical aids in this country to be plastic surgery and not necessarily dealing with a medical problem. I mean, when are we going to get to a point where we are now, of course, that becomes the next battle, that we are changing how medical aids see breast reduction and breast reconstruction?
I agree with you entirely, Morena. The medical aid industry, for the most part, classifies breast reduction as a cosmetic and not a medically indicated procedure. This while, some of my youngest patients start presenting with very large breasts or macromastia from about the age of 16. The breasts keep growing until the age of 20. So we have to do a lot of counseling in this age group. And beyond. The burden of macromastia in South Africa is huge. A lot of people are walking around functionally suffering. And, there are some medical aids that pay for it. I think GEMS does pay for it, the Government Employee Medical Services, CISO Medical Aid, and a few others. I'm not going to advertise them. Yeah. But for the most part, especially the bigger medical aids, they do not fund breast cancer at all. They view it as a cosmetic procedure. I believe that there are some breast reduction activists. They have a group on Facebook. If you are interested in a breast reduction, you should look for this group. And they are spreading the word about where to get the services, but also challenging the Council for Medical Schemes and the different medical aids to say that, this is a medically indicated procedure. So that's the kind of activism that we need in amongst our people. To create the life that we want. Exactly what you're saying, Morena. The demographics of South Africa are changing or have changed in terms of access to medical aid. And so, the services should reflect the current population that they're treating.
Most definitely. Dr. Monaisa, we're going to leave it there with you this morning. Thank you so much for joining us. That is Dr. Brian Monaisa, who is the founder of Smile Artists Africa. Of course, they do have a show next week where they are raising funds and, of course, awareness regarding breast cancer. It's going to be happening at the Cradle Boutique Hotel next week. You would want to go out there. And, of course, it is for a great cause, considering the conversation that we've just had with Dr. Monaisa. So you might, if you want to do something next weekend, the 8th and 9th of October, that is something that you can definitely go out and do.